With that being said, let's get started with some of these questions. So our first question that we have is, what is gender identity? And this question is directed at Dr. Chitani, please.
Thank you. Yeah, I'll take a crack at the first one. So gender identity. Actually, first, before I begin, I want to say Happy Pride Month to everybody.
Yes.
I'm so happy that we're doing this episode, and I'm so happy that we're able to talk about these important topics and really share this information with all of the parents and youth that are out there to hear that there are a lot of physicians, both in pediatrics and internal medicine, the whole gamut here to support you. So gender identity. Gender identity is one's innermost concept of self as male, female, a mix of both, or neither. And so it's really something that's truly internal and then can be actualized in external depending on the individual.
Okay. And so when might a child know their gender identity?
That is a really big question. So in pediatrics, we study, and in MedPeds, we study the development of a child from when they're born to when they become of adult age or beyond. And so for gender identity, there are a few milestones to be aware of. First is most 3-year-olds are able to verbalize the differences of male versus female. That's restrictive depending on what they've been exposed to and how they are talked to up until that age. By 5 to 6 years old, they're usually able to express internal feelings around gender. And then from 9 to 18, you have the adolescence roller coaster that is rapid in their development in this arena and allows for a lot of expression of what gender identity might be. Now for trans youth, there are a few other milestones that are mixed in there, but interplay within these age milestones that we know. The first is awareness, and then seeking information, reaching out and finding out more about what these internal feelings are. Then will come disclosure, where they'll actually talk to usually a significant other about this, whether that's a parent or someone else. Then there'll be an exploration of the internal self, then the exploration of the external self to make sure that the external matches what they feel internally. And then finally, the integration as a whole to become holistic, and that it integrates into all of their lives, and that being trans isn't the only identity that they have, but a part of their entire life throughout.
Uh-huh. And I appreciate that you touched on the age bracket of this, not only for developmental psychology, but also it's really important for us to know how should a conversation around gender and identity evolve based on the age of your child who may be trans or gender nonconforming.
Yeah, and that's really just based on the milestones, like understanding how concrete or what words a child to adolescent to young adult is going to use. A lot of it is once they reach that 5 to 6 age, you're going to use their own language. So you have to listen and be open to the conversation. And as long as you create that safe space for them to talk about what they're feeling, then you can use their words to better understand what it is. And if you don't understand, you can ask, oh, I haven't heard that term before. Or I want to make sure I understand what you're saying, what you mean by this term. Explain it to me more. Those kinds of questions just open the environment to allow your child to best express
themselves. A lot of the time we want to make the child the expert or the patient the expert. So that's very important. So Dr. Friedman, I have a question for you next, please. So what should the parent do or the caretaker do when they first find out that their child is LGBT? What are the first steps?
Did you freeze?
My internet froze, I think. Can you all hear me?
Yes, we can.
Oh my gosh. Can you hear me now?
Yes, we can hear you.
Oh my gosh, my internet is freezing.
Oh no. You might have to figure out his internet before we can address it. I mean, we can start with saying that in first addressing how parents will, when they first find out what to say or what they might do, is really what I started with being open in hearing, listening to what your child is telling you and creating that safe space.
Yeah.
And I'm sure Dr. Tolentino, if you have any other comments on that.
Yeah, so, and I'm sure Dr. Freeman will touch upon this, but being careful and really using open, inclusive language and asking questions, I think is one of the most important things as a child comes up to you. And I think what's tough is when we think about the developmental stages and we think about the concreteness as Dr. Shatani brought up, I think for some parents, what scares them or where they have some hesitation is the age at which they come to them, right? So when a 5-year-old comes up and has some more gender fluidity and just has lots of questions, it's tough because some parents want to make things more concrete and keep it very binary as opposed to being as expansive as possible, which is a very different conversation than when you're, say, in the adolescent age, 16, 17, 18, 19. As an internist, I've had 35-year-olds come up to me with these same questions. And I think this is one where the more open, the more inclusive we are with our language, when our loved one comes up to us and says, there's something not right, or I'm not, what I'm wearing or what I look like right now isn't how I feel inside. This is where keeping it open, keeping the questions as open as possible, and really helping them express and explore, but more importantly, avoiding the pigeonholing that many of us have experienced in the past, or how we've approached these questions before, will help with this. And I don't want to steal your thunder, Dr. Friedman, but
I'm back. I lost my internet connection, and I'm not even sure which question you're on. So I apologize, but I'm back.
I think the question was, what do you do when you first find out your child is gay, lesbian, bisexual, or transgender?
Yes, that was the question.
Oh, okay. And that followed up on Dr. Chatani's mention of milestones and age group of patients and children as these kinds of topics come out. And I would just say a lot of times parents already maybe sort of know and have an idea or are observing things that they are not surprised then when the young person tells them one of those sexual identity or gender identity descriptors. And the main thing that parents should always do with their children is tell them that they love them, that they support them, that they'll help with whatever issues or distresses, and that they're proud of them. And these are just general kind of parent and child interactions that are so important.
Mm-hmm. I have to stress, like, just saying those 3 words, I love you, is huge, huge. In that moment when a child is coming out, telling you about themselves when they're most vulnerable, I'm a parent myself, like, I understand, like, oh yeah, my children know that I love them, but there are those moments where it seems like they forget. And if you remind them in that moment, it makes everything different.
And I know from your bios that a lot of you have interest in long-term healthcare. And these are really important for things like the ACEs study and long-term medical health as well as psychological. So I appreciate that. Thank you. So speaking of support and resources, where can these parents find transition and support related resources in South Florida? Dr. Chatani, please.
So resources, there are a lot of resources actually in Miami-Dade and throughout Florida. I would say PFLAG is an amazing resource for parents. They have websites that are dependent upon a county, and they can seek them out and call them and find other parents that have already been through what they are going through, along with referral services there. If you're in Miami-Dade County, I have to give a shout out to the LGBTQ youth, the Alliance. They do amazing work for family counseling, individual counseling, and helping guide some of those more difficult conversations.
definitely. I think another really good one is Pride Lines as well.
For sure.
They work with youth. So I just wanted to let everyone who's watching know questions are open to the audience as well. So we don't necessarily have to go in uniform order. If you have any burning questions or thoughts, just enter it into the chat box and we'll get right to you. Okay. So after that, I just wanted to ask Dr. Friedman again. Hopefully your internet stays,
Thumbs up.
So after a parent learns that their children or child is LGBTQ, they might ask, why? Why is my child gay? Should I take them to therapy? Should they see a doctor? How would you answer those parents if they're maybe having a little difficulty adjusting?
Well, I frequently ask if they're noticing any distress or if they're recognizing some medical need or other psychological attention that their child or their teenage offspring, might be displaying. Because if there's depression or sadness or obvious substance use or school deterioration, there might be need to address particular issues first, or along with simultaneously the underlying issue that the child or the youth cites as being an instigator for the substance use or the school difficulty. And oftentimes it's those presenting actions that bring to the recognition that it's a psychological distress, maybe of some gender or sexual identity issue of their child, that is brought to their attention by some other aspect of health. It's also important to point out that it depends on the age group as well. If it's some person who's already pubertal and sexually active, there would be some need to attend to some of those sexuality aspects of interpersonal relations, maybe some sexually transmitted disease testing, maybe some talk of prevention methods and even pregnancy prevention. And so depending on the age group, we address things differently as well. And I would say also there's a continuum, perhaps. Sometimes younger youth think maybe because their attraction is to somebody of the same gender, that must mean that they're gay. And sometimes it turns out that it isn't an expression of that they're really not attracted to somebody of the same gender that's also attracted to somebody of the same gender, but maybe they're attracted to someone of their same gender who is straight. And that then is a contention that the youth has to sort of incorporate. Are they, quote, gay, or are they actually transgender? Or are they transgender and gay?
The delineation between sexuality and gender is very important when you're first learning the basics. I agree. There are some people, some young adults and adolescents who choose to wait before telling their support systems, their parents, guardians, what have you. What are some reasons that they might wait to say something?
Well, sometimes it's fear of what the reaction might be. Mm-hmm. Sometimes it's fear because they know what the reaction might be. Maybe there had been some discussion in the family or some overhearing of comments or adjectives that someone in the family maybe had ascribed to somebody else that they've seen in society or at church or in school or something. And so there's often fear involved. Sometimes there's lack of understanding of the actual child or youth in what exactly they're experiencing and what it means. And so some of the reluctance is just not knowing that it's a topic to bring up to someone important in their life, some adult who plays a vital role, such as a parent. Sometimes there's maybe lack of realization that they're actually going through something so important as an identity recognition. They don't know that it potentially could lead to some difficulties in life or coping or interpersonal relations.
Yeah,
and there likely are other reasons that the other doctors might cite as well.
I was just going to echo what you said about the fear, because the fear is a very real thing. When they survey, and we say all these with evidence in the literature that studies have been done identifying, okay, well, what distressors do these adolescents and young adults go through? The fear is very real. And then in evidence, we have that of the homeless population, the homeless youth population, 40% of them identify on the LGBTQ spectrum. And so that's telling of whether they were thrown out of their home or because they were so fearful of disclosing how they feel that they felt safer leaving the home rather than telling their parental figure. So that the fear is something very, very definitive there.
And the other thing I was going to add, so some of this fear comes from how we, and I think we're going to talk about this a little bit later on, but it's a good point to bring this up, is how we as parents right now talk about the LGBTQ community in general and how we address others who are either non-binary, who are gender non-conforming, and what have you, and how we speak about all the different groups out there will dictate how our kids and how our children will assume we will react to a lot of this. And and I think underneath a lot of this is a lot of the cultural norms that we're used to, and how we speak about marriage, how we speak about the future, how we speak about a lot of this. And I think part of it is that there's that fear of disappointment, there's that fear of violence, and then underlying all of that is a lot of that fear of what do I do next, since nobody's talked about or nobody's told me what it's like to be a gay man in blank, or a non-binary person in blank. And so this is where we have to be very careful about how we talk about things, especially when we start using it from a very negative tone.
And thank you for that, Dr. Tolentino. I actually had a couple of questions for you following that. A lot of these parents, as you said, kind of worry that this is a phase. They don't know how to navigate it structurally within the family. Is there any way to be absolutely 100% sure of one's gender identity or sexuality?
So that's a great question, because a lot of it, so when we think about gender identities, kind of going back to what Brandon first started off with, talking about the developmental stages in terms of some of the gender fluidity and that occurs, especially in the younger age groups, and as we start talking about different gender norms. But one of the things I always think of, especially with our teenagers, is that when they've come to us, they've been thinking about this, and they've been dealing with this and experiencing this for many, many years at that point. And it's taken a lot to come up to you and say, Mom, Dad, I don't feel comfortable in my skin, or I don't feel comfortable with these clothes, and there's something about what I'm doing right now that is not right. That took a lot of guts, but that took many, many years of understanding and realizing that there's something that isn't right with how they look, or how they're conforming in general. So I think one of the first things, kind of like we talked about before, is to assume that this is something that your child has thought about for a long time. This is where you start asking the questions. And you start off from the place of love, right? We talked about this before. You love your child, you love everything about them, and it's an unconditional love that'll get them to come out to you more about who they feel they are. And it's possible that they're maybe early in the process, and they want to talk about it, and they trust you as a parent to talk through this and talk about it, and talk about what they're comfortable with and what they are comfortable with. There's been studies that have talked about that some of the non-gender conforming activities in females are much more acceptable to parents than amongst when males do certain things that are quote unquote female gendered type activities. But while that somewhat normalization is out there, the more you create that safe space and the more you open that up, the more you'll get a better understanding that this is something that is absolute or not absolute. Now, what we know about gender is that gender is still very fluid and that gender can change. I know as parents, this can make us a little bit confused, and this can be a little bit of a stress for us as well. But realize that this is the journey that your child is also going through. So this is a journey that you guys are going through together. You will learn a lot from each other, but more importantly, the more you support each other through this, the better the outcomes are. All the evidence in Dr. Chitani and Dr. Freeman talking about this, the evidence behind a supportive family, and somebody's coming out either lesbian, gay, transgender, non-binary, is always better when the family and the support system is there to support them.
And if I might say, you made a really good point there too, Dr. Tolentano, that it's difficult for parents to recognize these things often also. So just as the youth are going through changes and wondering, and what is this feeling I have, it's okay that parents also don't have all the answers and are learning to deal and cope and help. And it could be a family endeavor that brings some togetherness also. Let's all deal with this. Let's all figure it out and recognize that there's some stress for everyone, siblings included sometimes.
Definitely. Could you maybe, Dr. Tolentino, give us some maybe some examples of what it means to be accepting versus affirming? I know that we've spoken a lot about that unconditional support and empathy, but what are some clear-cut ways that we can be affirming instead of just accepting?
Yeah, so that's a great question, because it feels like those two terms are very interchangeable, right? And the way I think of accepting is that you start off with accepting from the standpoint of unconditional love, right? You walk in and you say, I love you, I'm here for you, I will do anything I can to make this as supportive of a place as possible. And that's the first step, as that acceptance of your child as transgender, lesbian, gay, a non-binary, questioning, or what have you. But the next step is the affirming part. And there's different parts to the affirming, but the most important part that we can play is that social affirmation, that if you feel comfortable, even though your sex is male, that you are a girl, then we will do everything to make sure that you are a girl. We'll make sure that you have the right clothes. We'll make sure that you have the right binders. We'll make sure, from female to male, the right binders. We'll make sure that you have everything that we possibly can do to affirm that not only do you feel that you're a girl, but that you are a girl, and that you are everything that you wanted. Underneath all that is unconditional love. For us as physicians, our job is to make sure that you have the medical affirmation, that we're doing the right things medically to make sure that you are able to be the gender that you feel that you are, whether it's surgery, whether it's medications or hormones. There's a legal aspect. It's a huge deal to see on your driver's license that the right gender is on there. And while it may seem small, or it may seem small that in the computer system that it says that you're male, but we all know that you're female. That's huge, because that's almost like a societal recognition that you're who you are, or and who you feel you are.
Sure. I mean, there's plenty of literature out there about like that every day is a day of therapy, and someone experiencing what it is to be trans, that every day is a day that could be more affirming or not. And it's in every small action that Dr. Tolentino that seems small, that Dr. Tolentino pointed out, but really brings that day of therapy, that day of mental health. Mental health is out there right now. We're talking a lot about it in our society, which is amazing. And that's a huge part of the therapy, of the management for how to be and get to that accepting, integrated place for a person who's trans.
And there are also resources for parents, support groups for parents, and online aspects people can also find that might help them understand that other parents are going through similar kinds of coping issues, and that other youth are going through similar kinds of coming out and coping issues. That's very reassuring for people that they're not alone, that there are others that are dealing similarly, and there can be some strength in numbers and help from others' experiences.
Mm-hmm. Definitely. That was actually one of the questions from our audience. I was going to say, how can parents find support when their child wants to transition or discloses that they're transgender? What are some parent-specific resources? I know that you said there are resources out there. Could you name any off of the top of your head, Dr. Friedman?
Sure. There's PFLAG, Parents and Families of Lesbians and Gays, I think is what it exactly stands for. And there are textbook chapters and online Google kinds of queries that people can make. I think you're going to put some resources up at the end of this hour, but the American Academy of Pediatrics has a whole website devoted to parent resources and educational materials for children and youth, not just medical resources for the healthcare industry, but healthychildren.org has some information applicable to children's health, including these topics. Advocates for Youth is another organization. Locally, we have, as you pointed out already, Liam, Pride Lines Health Services, which is mainly supportive for youth and maybe some for the parents. And there's the Yes Institute. I forgot what YES stands for. Youth Education, I'm not sure. Services, maybe?
I think so.
Yeah, and there's also Transsocial, right? I mean, Transsocial.
Oh,
Transsocial.
Yes, and Positively Aware, and there are all kinds of different local groups. The Equality Federation in the Broward County area.
Yeah. And a shameless self-plug, Transsocial actually does free name changes, case management, and we do some testing and mental health services as well for your youth. If you're interested, we'll put that at the end probably, I think. But yes, thank you everyone for answering that so fruitfully. So going back to the youth specifically again, why does using proper pronouns matter? How do they differ from preferred pronouns? And then what are some ways we can be more gender inclusive in the way we speak, just generally, and then to our youth who may be struggling?
Yes.
Dr. Tolentino, if you'd like to answer that, go ahead.
Yeah. No, because like, so I'm a big person on pronouns, and I think I don't know, it's so important because it's that initial recognition, it's that initial and subtle and constant recognition of your gender, right? Of who you are. And it's kind of like telling somebody or continually mispronouncing or misspeaking somebody's name. You correct that, but for some reason we have a hard time with pronouns. But we use pronouns all the time. It's ubiquitous in how we speak and how we refer to each other. And to use the incorrect pronoun and to use the improper pronoun, I think is such a huge component to a lot of our own identity, especially for our trans youth. And one of the things I always think about is, how do we model that? As a society, pronouns becoming more, or asking for preferred pronouns or asking for your proper pronoun is becoming something that is more common in multiple different forms of what have you. But I think in our normal speak, this is one that actually takes a lot of practice and actually asking others for their pronouns, or actually putting your pronouns. Many of us are right now on Zoom and adding to our pronouns on our names to make sure that you know what my pronoun is that I prefer. It takes practice. It's not something that we have been taught to do socially. We ask your name, but we don't ask what your pronoun is, or your physicians won't ask you which pronoun you use. But that does take practice, and also takes practice not questioning it, and understanding that it's not a question. Why do you use they, or why do you use ze, or why do you use she or he? It is okay, you are they, or you are he, or you are she. And I think the subtle use of pronouns is probably one of the most public ways in which we can support our trans youth and the trans community in general.
And parents should know that we struggle too. This is hard for me a lot of times, since I've had a long practice and I have a certain speech, and a certain style of patient interaction. And I frequently am kind of restating what the question is to the teenage patient, or apologizing, or promising I will try to do better, or admitting that it is something to get used to. And parents can understand that they're entitled to take a little time to get used to it, but it's important for them to do that and to support the youth who's defining themselves in a certain way, that we don't doubt it, we understand it, and we try to emphasize that we're going to help. And it might take a little time, but we're going to help.
I can tell you, even as a transgender person, we mess up on other people's pronouns as well. So it's not just you.
Yes.
But that's great. So really, moving it out of the LGBT specific sphere, and then kind of normalizing it and bringing it into mainstream society is what you're saying, correct?
Yes. Cool. No, definitely. And I think bringing it out into the mainstream, it takes every single one of us to do it, right? And so practicing it, figuring out what's the most comfortable way that you would ask somebody as part of your normal speech. I think those are things that we can do to normalize this as much as we can, just as citizens here in South Florida, whenever we meet somebody.
So on that note, a lot of parents have no problem with LGBT, but when it comes to their own family, their own son, their own daughter, what have you, there's a little bit more difficulty. How can they unpack those feelings to kind of maybe embrace that it wasn't always an easy decision, and that there were some hurdles, there were some challenges, but it's something that can be overcome? How can we make them feel more comfortable?
Well, I think we can try to understand that there are these feelings, and we can also try to query as to whether there is a family member that is already out and is known to be trans or to be LGBT, and to maybe have the opinion of that family member, hopefully as a positive one, equating then their own child to that valued family member, the great aunt or the cousin, or someone who already has established a precedent in that family, is one aspect. And also that they can realize that nobody is expecting this to be an easy process. It is easy for some who have recognized maybe their children along the way displaying a behavior that they wonder about, or expressing in verbal language an aspect of themselves. But it isn't easy, and hopefully if they have the parents, have positive models in society or in their family, they can look to their children maybe following along those positive models.
Oh, and so we have a question from the audience, actually, from Christina, asking, do you need parental consent to get hormones or start transitioning with surgeries and hormones and all of that, the name changes? Do you need consent, or can you just go and get it done?
Well, I can just tell everybody the laws are different state by state, and they're changing and being challenged and new laws being enacted. And so wherever we live, we have to know what the current state laws and regulations are. There's some health care that teenagers who are less than 18 can achieve by their own consent and by their own confidential interaction with a clinician. But then there are other aspects of health that is not permitted. And I honestly will defer to either of the other doctors if they know currently what is the state in Florida, because it isn't the same as it was 5 years ago or even 3 years ago. And I honestly don't know in June of 2021 whether everything is able to be achieved confidentially and on the youth's own volition. I know there are certain aspects that cannot be on their own consent, like any kind of surgical procedure, any kind of intervention that's invasive needs a parent to be involved and to consent. But you asked also about hormone therapy. Mm-hmm. And in June of 2021, I honestly don't know. Dr. Tolentino or Dr. Chitani, do you know?
So my understanding in the state of Florida is that you still need, I think you still need consent under the age of 17 and younger in order, definitely for surgery and
yes,
replacement therapy. And fortunately, unfortunately, should I say, a lot of the laws for transgender youth become more restrictive, just in general. But hormone replacement therapy is still considered something that needs consent of some sort, and needs usually a parent to do it. It's interesting because you don't need that for birth control.
For sure. It kind of goes into one of the questions I think that's coming up in the future too, that we were going to talk about all the medical services that someone that identifies as trans may want to access. And so the term of consent is important, of where consent is and where it lies. For, like Dr. Friedman had alluded to, the under 18, there are some services, particularly around like STDs and certain infections, that adolescents can access services that is completely anonymous and without parental consent. But if it's a medication that's being prescribed otherwise by a provider, so hormones, whether it's to block puberty or as hormone replacement, I do want to make the distinction. There is a difference between those two and what they're meant to do. They do both require the parental consent.
Thank you. So, Dr. Tolentino, so when a child comes out as trans or is transitioning, they may start to present in a way that is very, let's say, shocking for the parent, or they may not even be within the confines of the binary. So when they can accept that their child is trans, but have a really hard time with that presentation, how can they approach the conflict and how can we work through it?
So I think this is a struggle. This is one of the struggles that parents have as they see their child, as they see the transitioning occur, where they are doing more of the social affirmation and some of the medical affirmation type therapies. And so I always start off first with parents recognizing that we all had different conceptions of what our child is going to be when they're first born, and what our thoughts and what they thought, what our conception of our child's future is going to be. but we always have to take a step back and realize that their future is guided by us, but isn't dictated by us, and that they're becoming who they are and who they're more comfortable with, and that while you're a part of their dream and you're part of their development, they're forging their own future, and that's wonderful. And so you have to support them, and supporting them means is that you're learning more about who they are, and the first time you really see who they are is usually when is that physical, when they're wearing different clothes, or they're taking on not different persona, but that they their appearance looks different. You have to remember that they're still them, right? They're still your daughter, they're still your son. They may have a different gender than you originally thought, but that's okay, because inside their personality is the same. Their loves, their fears, what they want to become, that can still happen. A lot of parents are like, "Will my child ever get married?" And it's like, yeah, maybe. That's the question that everybody has about the children. Are they going to find somebody they love? Now, will it be the marriage that you thought of? Maybe not, but that's okay. They're still going to find somebody that they love. They're still going to accomplish everything they want to accomplish, and a little bit of that. A lot of those futures are going to change, but those changes are going to be wonderful for your child. And if you take it from that, and you take it from a place of love, then it contextualizes a little bit better of that next step, and being able to actually recognize that this entire sense that this is not, I'm not quite comfortable yet, will become more comfortable. And as you become to learn who your new daughter is, you'll love them just as much as you loved them before, and that's wonderful.
And actually, many people know the entertainer Cher, who's world renowned, who has a transgender son, who she talks about as having this daughter that she had to mourn, in quotation marks, the loss of having a daughter, but then the pride in gaining a new son. And she talks about it, and has been interviewed about it in lay magazines and television programs. People can find it online, because it was really quite telling, as you just were pointing out, Dr. Tolentino, the pride she has now in her second son, and she no longer has a daughter, but had to deal with that aspect, that she no longer had a daughter.
Definitely. I think, Dr. Friedman, that's a great segue into one of our audience Q&A questions. An anonymous attendee said, I have seen a huge growth in non-binary identities in assigned female at birth teens that I know over the last couple of years. Is this a widespread thing? If so, what do you attribute to it? I believe anyone can answer that question.
The world is definitely changing. And we see that even from the age of disclosure, that what was where adolescents were primarily the age where they would disclose, we have younger and younger. And we actually have a South Florida resident, Jazz, that was able to come out and disclose her identity very early in life. And I think part of that is that now in the world, we have those mentors or those figures in the media that we can look up to, and that this generation can look to as role models for, hey, I can be that too. This is how I feel, and I can be that too. It's okay for me to disclose that. So I think we're seeing, I don't think this is like the development of something new. I think that this is something that was always there, but now we've made the world a little bit safer of a place for youth that identify as trans to really disclose this and make themselves known.
Yeah. And Dr. Tatani, I wanted to kind of maybe blend in two questions that we have, one from the audience and then one from our general panel. Our audience member asks, what kind of doctor do you go to start the transition process? Is it a neuropsychologist or would it be someone else? And then what is a medical transition versus a hormone replacement and gender affirming surgery? What are the differences?
So I'll start with the first question. The transition journey can begin in a lot of different places in the medical system. There are a lot of general pediatricians that have taken the onus on making sure that they learn what they need to be able to support a family in transitioning a youth. Lots of times, though, the transition will start with an endocrinologist because they can at least prescribe the hormone blockers to put puberty on hold while the adolescent is going through that exploration of their internal self. It doesn't, again, it doesn't have to be an endocrinologist. It could be a general pediatrician. It might even be an infectious disease doctor, who knows? But there are a lot of doctors that know how to prescribe these medicines very safely. They are very safe. They've been studied for a long time. And we know that it really won't cause any issue. So I spoke about blocking puberty from happening, and that's just putting a pause. It's literally a pause button. You can press play and things go out the way that they were supposed to naturally occur if the decision was, you know what, I'm ready for, my internal self is ready for this stage of puberty to occur. If the decision is, no, I'm not ready for puberty to proceed as such, I'm ready for puberty to go a different direction, then hormone replacement therapy can be initiated to help manifest those external features to match the internal identity. Then we talked about surgery, which I mean, I think everybody understands that that's a much more permanent and very serious decision to make. It's not something that physicians take lightly with families, and there is a process to go through with your physician to reach that decision and how much of that decision, because there are a lot of options even within that arena. There are entire clinics dedicated to it, and so you can find those resources within our.
Thank you, doctor. So we're just wrapping up on time here, but I just wanted to ask one final question for the audience and for our panel. What is a way that we can instill importance of inclusivity, acceptance, and affirmation, not necessarily maybe in specifically LGBT or transgender communities, but just generally speaking, using it as a way of life? How can we teach our parents and our youth to really think with an equal mind, let's say?
I think being open and being open and having that safe space in any way that you communicate is the starting place. No matter who I talk to, no matter what they look like, how they identify, how much money they make, regardless, my communication with them is that they're on my level. I'm not above or below them. They are a person just like I'm a person. They bleed the same way I bleed. And in that connection, that humanness, we're able to create a very safe space for us both to express what we need to express.
Definitely. There's a saying, don't judge your insides on somebody else's outsides. And I think that very well applies to this question.
For sure.
The other part I think about are things like this, is that when we know we don't know something or we need to know more, we have to seek out that information. We have to take it upon ourselves to learn more about this, right? This is why we're all here tonight. This is the reason that there are all kinds of really great resources out there on the internet. And I think as we start with the open mind, and then we start thinking, I have to know more about how do I approach these things? How do I understand inclusivity? How do I understand how to address people appropriately? And what it allows us to do is to then understand the subtle things that we do every day that can actually hurt another person. So we always go back to the pronouns. Something as simple as calling a he or a she inappropriately, it hurts. Those are those little small little paper cuts. And for us, it doesn't seem like a big deal, but for those who are actually experiencing that, that's a big deal. If I can take away one paper cut for one patient or for one person that I meet, that's a huge win for them, and it's a huge win for me and everybody else. And so take these small little steps, really start taking some of these skills that we've even talked about today and start thinking about what can I do differently now when I meet somebody and they're non-binary, or they're questioning and those type of things. How can I actually make their lives a little bit better, but also make me a better person in terms of understanding who they are?
Definitely. I think that's a great way to wrap up this segment, actually. Thank you so much. Wonderful, wonderfully said. So I want to thank everyone who has been on our panel tonight. It was an excellent, excellent discussion. It's very important and popular information, as one of our audience members sort of pointed out here. So thank you. And then I just want to do some reminders for everyone listening. Join us in 2 weeks on Thursday, June 24th for the Parental Guidance COVID Vaccine, Fertility, and Pregnancy segment. We will be addressing such topics as wondering whether the COVID-19 vaccine will impact your ability to safely get pregnant, from potential side effects to its safety and efficacy. Get up-to-date information on the COVID vaccine, whether you are pregnant, looking to get pregnant, or breastfeeding. And then also recordings of all parental guidance webinars, as well as downloadable tips and resources, can be found at jacksonevents.org, where you can also sign up for any other upcoming summer episodes. Happy Pride Month, everyone.